Post-operative instructions after bone grafting. Special considerations. A bone graft is typically made up of many small particles of bone. You may occasionally discover some small granules of this bone in your mouth during the first several days after the procedure and as healing progresses. There are several things you can do to minimize dislodged bone particles. Do not disturb or touch the wound. Avoid vigorous rinsing or spitting to allow stabilization of the blood clot and bone graft. Do not apply pressure with your tongue or fingers to the surgical site, as the bone graft material may move during the initial healing stage. Do not lift or pull your lips to look at the sutures. Do not smoke. Sinus lift. If your bone graft procedure was performed in the sinus cavity, please follow these instructions. Do not blow your nose. If necessary, just wipe, dab, or sniff until your return visit. Do not sneeze holding your mouth or nose closed. Sneeze with your mouth open. Use an over-the-counter decongestant, such as Dimetapp or Sudafed, as needed to reduce sinus and nasal congestion. Avoid anything that causes increased pressure in your nasal cavities, sinuses, or mouth. Do not be alarmed if you experience bloody drainage or the discharge of a bone graft particle from your nose. Notify our office if you are experiencing the unexpected flow of air or fluid between your mouth and nose. Bleeding. Slight oozing or blood-tinged saliva is not uncommon for the first 12 to 24 hours. You may be asked to keep a gauze pad over the surgical site with firm biting pressure for 1 hour. After this time, remove and discard the gauze pad. If bleeding continues, you may bite on a moistened tea bag in the same manner. Tannic acid in tea helps blood to clot. If bleeding does not subside, please call the office for further instructions. Swelling. It is not uncommon for swelling to occur around the mouth, cheeks, eyes, and sides of the face. Most swelling will not become apparent until the day following surgery and will not reach its maximum until 48 to 72 hours post-operatively. However, swelling and discomfort may be minimized by the immediate use of ice packs. Apply ice packs to the outside of the face over the area where surgery was performed for the first 24 to 48 hours. Ice packs should be left on for 30 minutes and then removed for 30 minutes while awake. After 48 hours, ice has no beneficial effect. Instead, the application of heat may be helpful in reducing the amount of swelling more quickly. On occasion, some residual swelling may last a week or longer. Pain. Take the prescribed pain medication before you begin to feel discomfort. This usually coincides with the start of the local anesthetic wearing off. Taking pain medication on an empty stomach may cause nausea, so it is recommended to take the pills with food or drink. Pain medication may make you groggy and slow down your reflexes. Do not drive an automobile or work around machinery while medicated. It is also best to avoid alcoholic beverages. Aspirin or other over-the-counter medications such as acetaminophen, Tylenol, or ibuprofen, Advil or Motrin may be used when appropriate. Antibiotics. If you have been placed on an antibiotic, take the tablets or liquid as directed until gone. Discontinue antibiotic use in the event of a rash or any other unfavorable reaction and notify our office immediately. Diet. It is best to wait until after the local anesthetic has completely worn off before beginning to eat. Start with plenty of fluids, such as juice, milk, or water during the first 24 hours. You may eat anything soft and cool the first day by chewing away from the graft site. Do not drink hot fluids or eat hot food the first day. Do not use straws, as this may encourage more bleeding. Avoid hard, crunchy foods and foods with seeds that may harm the area. It's best to progress to more solid foods and return to your normal diet as soon as possible. Oral hygiene. Our doctors may prescribe an antibiotic mouth rinse, Paradex, to begin the night of surgery and continue as directed on the label. Begin warm salt water rinses, half a teaspoon of salt in a glass of warm water the day after surgery, and rinse 4 to 5 times a day, especially after meals. Rinse very gently to avoid disturbing the bone graft. Continue to brush your teeth as best as you can, remembering to stay away from the surgical site. Sutures. You will most likely have sutures in the area of the bone graft. Even if your sutures are dissolvable, a follow-up appointment 7 to 10 days after the procedure may still be scheduled to check your healing. Activity. It is best to avoid strenuous activity for 2 to 3 days following your procedure. Wearing your prosthesis. Your removable dental prosthesis, partial denture, full denture, or flipper should not be worn immediately after your bone graft unless specifically instructed otherwise. Please check with our doctors about your personal needs concerning wearing your removable prosthesis. Please notify our office if you have any questions or concerns.